Prof, very good evening to you. Thank you for being with us. So there have been mixed messages on the issue of wearing masks. You saying, in fact, the wearing of cloth masks should be compulsory. Why?
Yes, so cloth masks act as a barrier. They can stop the transmission of infection from infected people into others. And also, if a person's uninfected and they wear a mask, it stops them from touching their face and picking up infection elsewhere and then transmitting it to themselves. And we know, for example, for other viruses like flu virus and even for TB, masks are very effective at preventing spread of these. And more, what we're learning from this epidemic, if you look at countries in Southeast Asia that are retaining control of their epidemics, like Mongolia, like Taiwan, China, Japan, all these countries have used a strategy of universal masking, everyone having to wear a mask, in addition to the other public health interventions, which are, of course, part of a total package, so social distancing and isolation of infected people, hand hygiene, and so on.
But, Prof, sorry to interrupt you. Just on the issue of the mask, what has been problematic with the masks, especially we see government leaders, people in the media as well, and other ordinary South Africans, has been the proper use of the masks, people saying that we are at a greater danger because we're not wearing them as we should, and that also increases the risk of getting COVID-19.
I think what we know now, but what we've learned, is that in fact many people are going to get infected and are infected. And if we look at the infection rates in places like China, United States, it's extraordinary. Large percentage of people are infected, and in fact, up to 80% of those people who are infected don't have any symptoms. So this is very important because people who are asymptomatic don't feel sick. They don't think they're sick, and they wouldn't wear a mask because they're feeling sick, but they in fact can transmit infection in communities and in their families. And we also know that people can transmit this infection just before they get sick. And so that's why wearing a mask is actually essential, and it's essential that everyone does that because as the slogan in the Czech Republic goes, my mask protects you and your mask protects me. I think if everyone wears masks in this way, the overall protection is net gain for everyone. And I strongly believe that this is a strategy that we must embrace in South Africa together with the other public health strategies that our government has so excellently put in place. And actually, our government has come out in support of cloth masks recently and changed the policy to recommend that everyone should wear a cloth mask in public. And you're right. Correct use is important, and you shouldn't share a mask. A mask should be worn for a day and then washed. One doesn't want to leave a mask lying around, and so on. But I think the public are savvy enough. We've dealt with TB for a long time. We've dealt with other viral infections. We need to be using masks cleverly and across the board.
Last question then, Prof. I want to ask about the science behind the recommendation that we need 3 layers when we do make these cloth masks, because we've been told not to buy the surgical ones, the N95 masks and the like. But why 3 layers? Why is that the scientifically appropriate measure when you make a mask?
Well, it's because the thickness of the layer, the thicker the layers, the better the protection in terms of a barrier. But actually, most materials are okay for making masks. 100% cotton is great because you can wash it each day. Denim is good. Even pillows or sheet material is good. And I think the important thing is to wear it, to wash it when you're done at the end of the day, and to wear it in every public space. Each person should perhaps have 2 masks so that one can be washed and one can be worn. 3 layers is ideal, but if you can't do 3 layers, even 2 layers is okay. The reason not to use N95 and surgical masks is because these are really in short supply and really should be reserved for our healthcare workers who are at the forefront of this epidemic in health facilities and who need the protection of surgical masks and N95 masks when they're doing procedures that are really risky.
Professor Heather Zar from the University of Cape Town, thank you so much for being on ENCA tonight.